Today we'll be discussing what is causing outbreaks of explosive diarrhea in the USA. This is Doctor versus Comedian. I'm Dr. Asif and this is the doctor of laughs.
Oh, sorry, I just got back. I had explosive diarrhea.
You're supposed to say not a real doctor.
Not a real doctor as well. I'm not a real doctor.
Every episode, what I usually do is to pick a topic for Ali from comedy and entertainment, and I question him about it. Then Ali picks a topic from medicine and health and grills me on that topic. But today is a special episode. Today, we're going to be doing two medical topics. I know. It's unprecedented, but we've been doing a lot of entertainment topics, so we thought, okay, let's do two medical topics that have been in the news over the past few weeks. So first, we'll be discussing the parasite Cyclospora, which is causing outbreaks of explosive diarrhea in large parts of the USA.
And might be entering Canada as we record this.
Ali, see, this is why we've talked about it. We've actually already had outbreaks in the past of this in Canada, but just no one told you about it. So we'll talk about that. And then we're going to talk about Katie Couric. We can go a bit into her career as a broadcaster, but she had an episode of what's called Transient Global Amnesia. So in our second half, we're going to be talking about that. How's that sound, Ollie?
Fantastic.
Yeah? Yeah?
Yeah, I'm into it.
Okay, good. Excellent. So just two things. I've been watching more movies as of late. I rewatched with my wife Nirvana.
Rewatch? You're not a rewatcher.
I'm not a rewatcher, but sometimes I feel so bad that I watched a movie without her that I want to rewatch it. So one of them was One Battle After Another, which I watched with her over the holidays, like Christmas time before the Oscars. And of course, she loved it. And then I saw Nirvana, the band, the show, the movie, and I felt really bad because it's so funny. And it just appeared, now it's on streaming on my TV. So I'm like, you know what? We're just sitting around, let's watch this. And it is such a hilarious movie. And I really want to talk to Ali about it, but I don't want to ruin any of the jokes in it or ruin the jokes for you guys who are watching it. So
let's let some time pass. Yeah, let's let some time pass, and then we'll ruin it for just a few people who didn't act quickly enough.
Yes, so I suggest people see that. The other movie I saw in the theater, I heard a lot about it. My buddy Joel texted me. He's like, man, have you seen Obsession? Obsession is this movie directed by this YouTuber, Curry Barker. His first name's Curry, very interesting. And these YouTubers, people criticize, YouTubers directing movies. I'm like, guys, they have practice from directing shorts on YouTube for years often and get millions of views. I don't really have an issue with that. And this guy knows how to direct movies. He knows how to write. And the premise of this is someone who is able to make a wish for the girl who he has a crush on to become like in love with him, and that's the obsession. And that's all I'll tell you about the movie. The less you know, the better. It's very well done. It is, though, however, and it has a lot to comment about, this kind of obsessive. Everybody, I think, has probably been in a relationship where either they're the obsessive person or someone has been obsessed with them. So it
Don't know
talks
what you're talking about.
Yeah, which one is Ali? He's been both. And the kind of personality disorders associated with that, but it also talks about incel culture. There's a Romeo and Juliet illusion. It's pretty good, but it's extremely violent. My wife, I think, would like some of the concepts in it, but I don't think she'd like the violence in it and the goriness of it. So, but if you like horror, I would suggest you check that out.
Obsession.
Yeah.
All right.
Yeah, okay. But listen, enough about me blabbing on about these movies I've seen recently. Let's get started talking about, you got that right, explosive diarrhea.
Okay, so this, would we say parasite, or would we say
it's a parasite.
bacteria?
Yeah, it's a parasite.
Which is also a bacteria? No, it's a parasite.
No. Okay, so this is a parasite, as you said, and it causes an infection, an intestinal infection known as cyclosporiasis. I'll be honest, Ali, until this outbreak, I actually never heard about this. Even though it's like infectious disease doctors, food specialists will have known about this for sure, but I just never did. It's usually found in tropical and subtropical regions, and that's where outbreaks can occur. But because we import produce, then it can also cause this here, and in North America, a foodborne illness, because it's because of where we're ingesting these foods.
So this is related to the idea for you and I, India, Pakistan, for some people, Mexico or some places in the sub-Saharan, don't eat fresh vegetables. They've been washed with the water, and you won't, don't have ice cubes in certain countries. That kind of, it's related to that. It's this
Right,
idea of
right,
like
right.
food that, yeah.
Yeah, that's
Okay, so
contaminated. Yeah.
here's because I know this answer. It's unfortunate that I have to hear these words come out of your mouth, but how do people become infected, Asif?
Because you know this answer. So it's by eating, like we said, contaminated food or drinking water, as you said. That's why it's an issue in countries because they're washing the food, which is great, but they're washing with contaminated drinking water. But contaminated with, Ali, human feces. That's the issue here.
I know.
So
Well, this has actually been on
yeah.
my radar for, I would say, about 20 years.
Hmm.
Julian Armstrong was this wonderful woman who did the food column at the Montreal Gazette, and she and I got to know each other. And she had told me, she probably told me as a South Asian chef who would be, very keen to use cilantro in 90% of the things he's making, as the Mexicans do the same thing. And she said, by the way, you make damn sure you wash that cilantro because the farmers, specifically with cilantro, often unethical. And so the workers will request a bathroom break, and the people running the farm will go, no, just go right there, take a dump in a field, and then come right back and continue working. So you imagine, first of all, there's feces in the field. Second of all, you haven't really, done the classic a washing of your hands several times that we ask for in restaurants. So she got that in my head a long time ago. So this doesn't come as a surprise, but it still comes as a very, displeasurable concept. Can you catch it from another person, Cyclospora?
That's pretty unlikely because it usually has to spend just the life cycle of the cyclospora. It needs to spend a few weeks in the environment until it becomes capable of infecting someone else. So that's very unlike other causes of infectious diarrhea. So that would be pretty unlikely.
Tell me about the symptoms that are caused. We know about the diarrhea. So best case, watery. Worst case, explosive. I'm sorry to laugh about it. It's I'm an infant who is still entertained by diarrhea for some
Yeah,
reason.
you are. So yeah, watery diarrhea, frequent, as we said, explosive. People love to use the adjective explosive in front of the diarrhea and projectile in front of vomiting. The doctors love those two things. Um, but then abdominal cramps, things you expect: abdominal cramps, nausea, loss of appetite, body aches. Sometimes you get a fever, weight loss. The symptoms usually start about a week after you are exposed, but it can range. It can be like just a couple days after you're exposed to a couple weeks.
Yeah, that week period is what's making this even more challenging because how do you go back a week and be like, oh my God, there was that one meal on that day. I mean, it's just, you make yourself crazy trying to pinpoint where this all started. So tell me about who is at greatest risk, who is at lower risk. I mean, is it as simple as people who don't eat vegetables are in a great place right now?
Yeah, that's perfect. No, I mean, you think about the people who get a more severe illness. So it's the typical people, children, older adults, elderly, and people who are immunocompromised. So those patients can end up having more serious disease with more weight loss, even intestinal damage. But it's interesting. People who live in endemic areas probably get repeated exposure to the parasite. So they actually get milder illness as opposed to say you were traveling to an area and get it, you're going to get a more severe illness because your body has never been exposed to this. But in fact, what they're saying is people probably get repeated infections over time and develop sort of a tolerance to the parasite.
How does it get diagnosed? How do you know? This is an interesting question for me because in my family of four children over the last whatever it's been 15, 16 years, stomach issues are prevalent. They come, they go, they raise their head. You're like, oh, this is going on for a long time, and then it's gone as quickly as it started. When do you go get diagnosed, and how is it diagnosed?
Yeah, I think this would be relatively severe. Okay, so it would not be a mild kind of stomach upset and going on for a prolonged period of time. You would start to get concerned about that, right? Usually most people, you have a diarrheal illness, it's a couple days, you're feeling unwell, and then you feel better afterwards, right? But so you actually have to do a stool sample. Ali, you have to collect your stool, bring it into the lab, they'll test it. But sometimes you need several ones because it may not be present. They may not be able to detect the parasite in every stool sample. So multiple specimens on different days are often required. And you have to basically do a very specific testing looking for this. I won't go into the details of it, but a regular what's called stool culture may not pick it up. So you have to have a bit of an index of suspicion that you're testing for that you think about parasite infection. But again, a lab can know that if you think this is a possibility.
And once they find out, let's say that you do have it, how is it treated? Can it be treated?
Yeah, it's treated with a antibiotic. Actually, it's called trimethoprim sulfamethoxazole, but you've probably heard of it as Septra. I don't know if you've heard of Septra. Bactrim is another
I
name
have.
for it. It's a
I
pretty
have, yeah.
common antibiotic that people take. I think we've all probably taken it at least once in our lives. And most people respond well to treatment, recover in a few days. But it's almost like you need to have an index of suspicion because this usually, if you have like an infectious diarrhea, it's usually caused by a virus. We talked about norovirus before, norwalk virus. You're not going to treat those with antibiotics. You just kind of like let it run its course and it will improve over time. So you have to have a bit of an index of suspicion that this might be what's going on.
This other scary part here is that washing your fruits and vegetables may not be enough to prevent infection. Why is that?
Yeah, it's a good point. And you've probably read that in the news. So one of the issues is this type of parasite is quite resistant to typical routine chemical disinfectants, and it can actually kind of stick to fresh produce. I mean, people still recommend you should wash fruits and vegetables under running water, scrub produce, practice good food hygiene, but it just means you can't guarantee complete protection. So if there is an outbreak, it's very important for, whether it's in a developed country, developing country, to identify the source of the outbreak and kind of control that. By the way, I also recommend that people wash, when you get by the bagged salads, like the mesclun mix or whatever, you should wash those. Even if it says triple wash, man, just wash it again. It's the least you can do,
Yeah.
literally.
Some of the advice is that don't buy a bagged mix, buy like a head of lettuce instead. You're better off. The bagged mix is a little bit of a, but we'll get into that in a minute or two. This is very interesting that it is becoming common in developed countries, right? As I was mentioning out of the gate, this is once you travel, you get hyper aware of what I should eat, what I shouldn't eat. So talk about that a little bit. Why is it
Yeah.
more common here?
I mean, it really is because we're, over the past several decades, we're importing more and more fruit. People want to get their fresh mango from other countries. They want their passion fruit. They want their dragon fruit.
And they want it in mid-December. That's the
Right,
big
exactly.
problem.
All year round, not just when it's in season. So obviously, if you just stick to what's in season in your country, you might be a bit safer. But we're importing stuff all the time, and you'll see that there have been outbreaks documented. I'll link to an article about this, but since at least the 1990s in North America, and so it's just that we're importing more things over the past couple decades, and so this is going to happen, unfortunately.
And have we found out which foods are linked to this? I mean, we mentioned the bag salads and all that, but is that all just like possibilities and theories, or do we know exactly which foods to avoid?
This current outbreak, which has infected thousands of people in the US, we actually don't know what caused it. And but in the past, it's been like lettuce, cilantro, mesclun mix, as we talked about, snow peas, green onions. Ali's worried because this is everything he cooks with. But it's kind of interesting to go over a couple stories because I find this epidemiology work really interesting. So, like in 1997, there was an outbreak in like kind of Virginia, Washington, D.C., that kind of D.C. area. And so the Department of Health went in and they found that about 54 employees who worked for a specific company, they don't name the company, went to a corporate luncheon. Again, why do we call it lunch and not a luncheon? I don't know. Or, I don't know why sometimes it's a luncheon. Why couldn't it just be a lunch?
Yeah,
Or they
you're
ate
not getting off track at all.
no, and they ate leftover food the next day. And it was catered by a company in that DC area. So then they do investigations. They ask everybody, what did you eat? And then they ask people who were healthy, what did you eat? And they try and narrow it down. So it was basil? Do you say basil or basil?
I'm a normal person, so I say basil.
uh, a basil pesto pasta salad. Listen, Ali would eat this salad. That's why I'm bringing this up. and they found that that was significantly associated with the cases. And then that was like the theory. Another one where and then there's a similar case in Missouri where a bunch of people, I think it was at a birthday party at a country club, and they like again did this kind of interviewing people to see what they were exposed to. Chicken pasta salad contained basil, and as well as red onions and red peppers, but they kind of worked backwards and were able to find that there was a basil distributor who received things.
Basil is the character that John Cleese played in Faulty
It's
Towers.
also a city in
Basil.
Switzerland. I know. And then basically found that this was purchased from a specific Mexican farm. So they were able to kind of go backwards and figure this out. Again, Ali, there was another case for raspberries this time. And then there was another outbreak of raspberry infection. This was before, the year 2000. This was in Philadelphia, Pennsylvania. So this was unfortunately at a wedding. So I think 83 attendees got sick and some catering staff, which means that they probably ate some of the food. So they had to like go back and figure out what could be it. And then they interview people, they go through all the statistical analysis, and they said, Ali, it was the creamy filling of the wedding cake, raspberries in the creamy filling. They
Let
then
me ask you: you get explosive diarrhea at a wedding. Do you take your gift back? You just go
I
in,
would
get that
I
envelope, and
would.
that's bad. That's mine. Yeah.
Ali's like, here's a gift for you. Gross. Anyway, so
Gross.
um, they actually then found leftovers of the wedding cake, and then they checked for the DNA of the Cyclospora parasite. Found it. They're like, yes. Then they go backwards, found out where it came from, imported for a specific company, and it was from a Guatemalan farm. They went to the farm and found that, yep, these guys were the ones supplying it, and then linked to the Cyclospora outbreak. So, it is kind of scary right now.
Right. Okay. So what are the key take home messages for people who are worried about this, who have not gotten it and are like, is it at my doorstep? What can I do?
Yeah. So, like we said, there's this outbreak in the States. It's the largest ever recorded cyclospora outbreak in the US. They don't know the cause right now, which is very stressful for people. In Michigan, where there's been a lot of cases, and of course people are worried because Michigan borders Canada, could it come here? Who knows? They think it may be lettuce or salad greens, though they don't actually know. Again, it takes a lot of effort from these epidemiologists and infectious disease specialists to work backwards to find the cause. So they say, we should be careful. You got to wash everything carefully and consider purchasing whole heads of lettuce instead of those pre-packaged salad mixes. Ali, I know, is not a big fan of prepackaged salad mixes, so I don't think he's doing that, but I think a lot of us do to save time. And again, if you think you have these symptoms, prolonged watery diarrhea, especially if other people who are eating the same food may have it, go see your doctor. They may have to do specialized stool tests. You may have to go back several times over several days to repeat the stool test, but there is a treatment, which is good. As we mentioned, a lot of these diarrheal illnesses do not necessarily have a treatment other than like just keeping up your fluids and things like that, which you should also do with these. But this one has a specific treatment which could help you. So you need to see someone if you think you've developed this. Okay, Ali, for our second medical topic, we're going to talk about Katie Couric and transient global amnesia. I know you have some thoughts about and questions about exactly what happened with her, but I thought we could do a little mini entertainment topic because Katie Couric's been a fixture of news, for
A
decades.
form of entertainment, some might say.
Some might say, especially these days. So, what about some career-defining moments for Katie Couric? Anything that you kind of remember?
Well, I mean, she made history at CBS. Let me start with something positive here. 15 years dominating morning television on the Today Show, and then she makes television history in 2006 by transitioning to evening news. So she was the first solo female anchor of a major American network. I thought it was Connie Chung.
But she was co-anchor, right? I thought.
Yeah. So it was Katie Couric doing a solo. So this is like, male-dominated industry primarily. She shattered the grass. She shattered the glass ceiling there. So I think that's very commendable, great for her. I will also say, and this is good and bad, she was quite clearly the inspiration for the morning show. I don't know if you watched Morning Show.
I don't.
She was Jennifer Aniston's character. And Steve Carell was, I mean, to me, it's 100% clear that he was the inspiration for Matt Lauer. And Katie Couric and Matt Lauer were incredibly close, tight-knit for about a decade on the Today Show. They were co-hosts, and she called their relationship, you know, she had like some biblical connotation for how close they were. And then in 2017, multiple women came forward with allegations of sexual misconduct, which is exactly what happens in the Today Show. And then Couric was like, which is exactly what happened on the morning show. And then Katie Couric, it's the same thing. She goes, I had no idea about this. She goes, I learned that there was a dark side to my co-host that I knew for 10 years. And people are like, really? You didn't know anything? Or did you just ignore it? So she said they don't talk anymore. And it was the same thing in the morning show, which kind of made the morning show very, you know, connected to the world we live in. I didn't find it like, oh, this is a ripoff of a real life story. I kind of enjoyed that in the show. I don't enjoy that for Katie Couric, having to have that, you know, acute inspection into her life about what did you know, how much you know. But anyway, that what the truth is, we'll never know. But yeah, that's a sad part of her legacy as well. But she's done her best, even in her memoir, to erase that, confirm that she was deeply disappointed when she found out all this, all these allegations.
For me, the two things I think about is one, on-air live colonoscopy. You know, she lost her first husband, I believe it was her first husband, Jay Monahan, to stage 4 colon cancer in 1998. So, you know, she's a big proponent of cancer screening and colonoscopy. So she had a colonoscopy live on the Today Show, but to be fair, I mean, you could say, oh, it's a PR stunt, whatever. It resulted in a 20% spike in colon cancer screenings across the U.S.
I hope our listeners can appreciate that you and she had a live colonoscopy on air, and then you said, but, and you really nailed home the word but.
Oh my
Not on
God.
purpose, but man, did you ever nail that home? And you know what? That series won a Peabody Award. It was like, it's really quite something, and full credit to her for doing that. It was all, you know, there's an added benefit of getting viewers, but it's all like, look, I'm doing something that's going to help, not demystify, but destigmatize colonoscopies. And I think that's wonderful that she did that.
And of course, I think her biggest claim to fame would be this multi-part Sarah Palin interview in 2008. People kind of forget what happened. Sarah Palin was announced as John McCain's running mate. And, you know, I think John McCain, he probably had a chance in the election. He picked Sarah Palin to kind of appeal to, you know, a certain demographic of voters. People didn't know anything about Sarah Palin. They're like, oh, it's an interesting choice. It was kind of out of left field, and people didn't know anything about her. The main way we learned about Sarah Palin was through these interviews, and then the subsequent parodies on Saturday Night Live with Tina Fey and Amy Poehler. That's actually how it happened. But again, people kind of forget this and conflate this. So Sarah Palin turning into a caricature, she kind of like, it was Katie Couric's, you know, interview with her that kind of like revealed all these flaws and how grossly unprepared Sarah Palin was for this role as a vice presidential candidate. And I think you could argue that, you know, there's a lot of obviously momentum behind Obama, but certainly McCain's campaign was not helped by Sarah Palin.
I think what I remember is we all learned that Sarah Palin was a moron. It discredited John McCain in an enormous way. I was like, this person is an absolute goof. This person should not be in politics. And that's why, to this day, I have such a disdain for softball interviews. You know, I wouldn't say that Katie Couric was like, you know, we didn't put her in the hot seat, but she definitely was like, I'm going to push back on that. Let me challenge that. So what do you do? Well, you mentioned this. No, you mentioned it. I didn't. You mentioned it. So tell me more about that. And you go, this person is woefully unprepared for life, just living life. Never mind running helping to run a country. So yeah, I remember that fondly.
So yeah, I think that those two things for me would be her main highlights from her career, though, as we said, she's had a career spanning decades, an extremely accomplished person. But yeah, so Ali, did you hear about this episode that she had recently, a few weeks ago?
I did. It came into my algorithm, Transient Global Amnesia, and immediately I was like, I wonder if Asif knows what this is. You have come across this, what would we call it? Phenomenon? No. What is it? Condition?
Yeah. And any of those things. I've seen it twice. So I've been practicing for almost 20 years. So once in residency, when I was doing my adult neurology rotation, we saw someone in the emergency room. And then I saw a 17-year-old guy a couple years ago.
So I should remind people that Asif's a pediatric neurologist, so this doesn't happen in children, obviously.
Yeah, it does, but just very uncommon. So 17, we still say as a child. Well, adolescent, teenager, almost adult. So what happened with her is she gave a couple talks. She was in Aspen in the morning.
This is obviously Katie Couric, not the 17-year-old.
Yes, that's right. Basically, then after she gave the talk, she couldn't remember anything. She remembers picking out her outfit that morning. She remembers her partner driving her to the Aspen Institute campus where she was giving her talk. That's the last thing that she remembers. And she did a panel on AI and journalism. Nothing, no idea about that. And then when he got home, and she wrote a post about this on her website, but she can't write what she forgets that she forgot about. So it's her partner saying, I noticed that she wasn't feeling well. And then the more he was questioning her, she had altitude sickness. Is she coming down with something? But then she couldn't remember the names of her grandchildren or her daughter's boyfriend. This is not normal. We have to go to the hospital.
Okay, so she remembered things that happened earlier in the morning, picking out her outfit and all that. She didn't remember being on stage on that panel, but did she say anything weird or blank out during the panel?
Apparently not. Apparently, no one had any idea from what I read until, her partner was talking to her and just that's quite unusual. And so they brought her into the hospital and diagnosed her with transient global amnesia. And then things just reversed and she was back to normal.
Okay, so let's talk about what is TGA. Do we call it TGA?
You can call it TGA. Yeah, so that's transient global amnesia. So it causes this temporary form of amnesia. There's two actual types of amnesia. The one that we know about the most is we see it in movies someone hit their head and then they forgot something from the past. That's called retrograde amnesia, where you forget what happened in the past. And we've talked about this.
And that's real, right? You said someone hit their head. You're a little bit dismissive and callous about it.
Because the way it happens in a movie is you hit your head, then you have this amnesia and you're going about it. But if you have a head injury serious enough to cause that amnesia, you have a severe brain injury. It's not a minor kind of bump on your head, unless perhaps you have this transient global amnesia. But otherwise, it's a very serious thing. So, people being conked on the head with a frying pan and then forgetting, that's just a complete exaggeration. But you also develop anterograde amnesia, where you can't store and remember new memories. Again, we did a podcast about this years ago, but that's that movie Memento, right? The Christopher Nolan movie where Guy Pearce's character cannot generate new memory. So we can see both of these. And when you have the transient global amnesia, you have this, right? You forget the past as well. During that time, you cannot generate new memories as well. And it usually most episodes last between 1 and 24 hours.
You've seen it in an adult, you've seen it in a 17-year-old, but who typically gets or develops transient global amnesia?
Usually it's older adults, 50 to 70 years of age. But it can occur in any population. Like I said, I've seen it in kids. The adult I saw was probably in his 40s, so not in a typical age range. But it's just important to be aware of. It's super rare. Again, I've seen thousands and thousands of patients. I've only seen it twice. But you have to be aware of it to know what's going on. No, this is a possibility. Maybe it's not a stroke. Maybe it's not drug use. Okay,
so let's talk about that. Putting Katie Couric aside for a second, what do people say that they're going through that you go, oh wait, this is we've got a case of transient global amnesia here.
So again, you don't have the ability to generate new memories. So they'll be asking the same questions over and over, if in the hospital. So where am I? Then you tell them. Then a few minutes later, so where am I? And so they will.
And just to be clear, this is with people with fully health. There's no connection to dementia.
Exactly.
There's no connection to.
Good point. Completely healthy people, and they look fine. So obviously, if they're comatose, and you're asking them a question they can't remember, well, that's different. It's because they're semi-comatose state. Maybe there's some sort of infection or something more serious going on. But this is they're completely alert, just chatting with you, but they can't remember. They can't recall the events that led up to the episode, just like Katie Couric, remembers, getting dressed and thinking about going to the farmer's market or whatever, and then that's all she remembers. So she can't remember that. But older events they can remember usually. So that's why she could maybe remember the names of her kids, but if her grandkids are relatively young, maybe she doesn't remember them. Or if her daughter's boyfriend is relatively new in the picture, she doesn't remember that. Also, they remember who they are. So it's not like she's like, who am I? Who's Katie Couric? No, she knew who she was. It's just some of these memories, and the more recent memories, the harder they are to recall during the episode. Otherwise, looks completely fine. Not weak, not no numbness, nothing.
So this memory loss lasts between an hour to like a full day, you're saying, but does it all come back then? Once it's over, it's like, oh, that was weird. Everything's come back, but for a while I couldn't remember it. It just
Yeah, that's a good question. So not really. They say it memory recovers in a telescopic fashion. So the oldest memories return first, and then followed by a gradual return of recent memory. But there will be a period of time that you do not remember. And it's the period of time, again, like Katie Couric gave the talks, and then after that was not able to remember anything, afterwards. So those memories are usually permanently lost because you have to be able to store the memories, but there was the inability to store the memories, to generate new memories. So that period of time will be lost, but you will remember everything kind of preceding the episode.
anyone who's been blackout drunk is really resonating with this right now, I imagine. But that, is attributed to excessive drinking. What causes, do we know what
No,
causes
we
this?
don't know. We don't know. But there are some theories, and the most prominent theories that's related to migraine, because 12 to 30% of patients who have this have a history of migraine. So we think it's kind of a migraine variant. And basically you have dysfunction in an area called the hippocampus. The hippocampus is an area that's kind of like seahorse shaped. That's why it's called hippocampus. It's in our temporal lobe, so the area underneath our temples. And this area controls memory. So they think that there's a dysfunction in that area, whether it's a problem with blood flow or some sort of seizure activity. We don't actually know. We do know that migraine, you can get symptoms with migraine, right? That's why you get a visual aura with your migraine. So the migraine isn't just the headache. You can have other symptoms associated. So perhaps these other symptoms in this case are this kind of memory loss.
So it's not triggered by some stressful event?
It can be. It can be. So the common ones could be a stressful event. So maybe Katie Couric was stressed about giving this talk on AI in journalism. I don't know. We don't know if that's true or not. So maybe that's it.
Hard to believe with all the things she's done
Yeah,
over her
she's
career.
yeah. Public speaking is definitely one of her strengths, right? It shouldn't be something she'd be nervous about. So it could be that, but exercise, sexual intercourse. Some people say
Katie?
sudden immersion in cold or hot water, or a severe emotional, stress or trauma can sometimes do it. I think the young patient I saw, the 17-year-old, was skiing. I think he was an active skier, like alpine skier, and he had maybe just done a competition, or he was heavily involved in skiing that day. So there was kind of a vigorous activity that may have precipitated, but other people, no trigger.
Sudden immersion in cold or hot water is very interesting, hot tubs, cold plunges, especially with people doing all these cold plunges.
Yeah, I think it's something that's creating a shock to the system, probably a release of what we call catecholamines, like adrenaline, probably has something to do with it, but we just don't know enough about it. And it's not that common.
Okay, so I should ask you that. I should have asked this out of the gate. It's not that common. How common is it? How many people get this in a year?
Yeah, if you take like 100,000 people, the general population occurs about 3 to 10 per 100,000. So it's not impossible, but it's just not that common. But it's actually more often, it occurs more often again in older people, like I said, over age 50. It's like 24 to 32 cases per 100,000. So definitely more common in older people. How about I'll just say this? And Ali, I don't know why this is, but it has been shown that it occurs more often at certain times of the day. So from 10 a.m. to 11 a.m. and in the late afternoon, 5 to 6 p.m. I don't know why.
Very interesting. 5 to 6, severe emotional stress related to traffic, perhaps?
Oh, yeah, that's right, probably.
And then everybody having sexual intercourse at 10 a.m.? I don't know. I don't have the answers if you were looking for them, Asif. I'm sorry about that. Tell me how it's diagnosed.
Yeah. So usually it's a clinical diagnosis. Again, you just hear the symptoms, the isolated amnesia, both for past events, inability to generate new memories, and very importantly, they know who they are. They don't forget who they are, and they have otherwise normal neurologic examination, no other issues, just the isolated amnesia.
They don't need a brain scan? Everybody doesn't need a brain scan?
Good question. So yes, they do need a brain scan because again, you have this abnormal episode out of the blue. Most people do an MRI because it could be a stroke or something like that. Again, less likely if it's just memory impaired, but you should do an MRI scan. but the immediate MRI is usually normal. So this is something that is very important. We teach all of our residents and trainees in neurology. If you suspect transient global amnesia, the first MRI done within the first 24 hours is usually normal. You actually have to wait and repeat the MRI scan at 24 to 72 hours. And then sometimes you can see very subtle changes, these tiny abnormalities called diffusion weighted changes in the temporal lobe. It could be on one side, it could be on both sides, in this hippocampus area that controls memory. So these findings can support the diagnosis. You don't need to. Your MRI can still be normal at 24 or 72 hours, but you just have to remember the initial one can be normal and you might have to repeat it after a day or so.
And it seems like it's different from a stroke because none of those classic stroke symptoms appear.
No weakness, numbness, vision changes, sensory problems, balance problems.
That is not associated with TGA.
No, exactly. And if you see those things, that's not what's going on. It's not TGA. Yeah.
I'm not sure if I'm getting what the treatment is exactly. Have you mentioned that?
No, there's no treatment. There's no medicine or anything you give. It just kind of resolves on its own. So usually what happens is people will be observed in the emergency room or in the hospital until things start to improve. And then they say, okay, well now I can say this is what it was.
So the reason you go through all the tests is to rule out something more serious. Although I guess this could be serious. Yeah. This definitely, like emotionally, this has got to be like a real bad trip here. Does it reoccur? Does she have to be like aware that this could happen again? Katie Couric?
Yeah, it can. It's just not very common. So, maybe it's a wide range. 3 to 25% of patients could have a recurrence. So up to a quarter could have a recurrence, but that's unlikely. Most people, it's a single episode and that's it.
Well, it's sad that it can't really be avoided. So, I would like to ask about a take-home message for listeners. I guess just you should be able to recognize if it's happening in you or somebody close to you.
Yeah, I think the bottom line is if someone ever develops this, you should just go see a doctor immediately, go to the emergency room because you need to rule out a more serious cause. Again, it's one of those very interesting neurologic syndromes that is so serious the way it's presented. Someone cannot generate new memories. They can't remember what's just happened to them recently. But it's also benign in that most patients just go completely back to normal and have no recurrence, right? So it's so dramatic when it occurs, but it's actually reassuring as long as all the other testing's normal.
Okay.
So everyone, that's our episode for today. Let us know what you guys thought. Reach out to us, drvcomedian@gmail.com, drvcomedian on Twitter, Facebook, Instagram, Blue Sky. We're everywhere. Curious what you guys thought about this. Again, try to keep this topical with 2 medical diagnoses that have been in the news as of late. Let us know what you guys thought. Again, are there other things going on in the news that you want to hear about? Let us know. Reach out to us. Ali, what do you got going on for the month of August? Like the end of July now?
For folks in southern Ontario, I'm in Stratford for 3 days. I think it's the 21st, 22nd, 23rd, interviewing some phenomenal authors, Tanya Talaga, Jan Martel. People may know Jan Martel, Life of Pi. He's written a book called Son of Nobody. I'm interviewing him about that, and then doing another interview about Beckett and Waiting for Godot in particular. It should be. I mean, it's out of my my regular life, but it's in the world of literature, which I really love, and I'm excited for that.
Okay. What festival is this?
Stratford. You heard of Stratford?
Stratford Festival. Yes. So you want to tell people a bit about that who don't?
These are in the morning. So Stratford is known for the plays. It's the home of theater. The Shaw Festival and the Stratford Festival are just, I guess, I'm going to say 4 to 5 months of incredible stage plays, theater. And so, for example, Macbeth, and if you go look up stratford.com or .ca right now, you'll see all the incredible plays that are on. And some of my interviews are connected to playwrights. Some of them are just authors who are working on new stuff. And it's in the morning, 10:30 to 12, so that you have your whole day to watch plays. Death of a Salesman is on. I'll be going to see that as well.
It'd be so good, man.
Yeah.
A great play. Yeah, so and this is Stratford, Ontario, of course, not Stratford, England, but still.
Still a good Stratford.
Named after the town in England. That sounds great, Ali. Hopefully I will get down to check that out too. I would love to go see some of these plays.
Yes.
But listen, everyone, before you go, just remember that although I'm a doctor, I'm not your doctor, and definitely Ali Hassan, the doctor of laughs, is not your doctor. So if you get sick from watching stuff with baking soda, you can't sue him. Please consult your medical professionals for actual medical advice. Thanks for listening.
Bye bye.